CMH was founded in 1982 as a public hospital district with the vision of taking care of the people in a rural community north of Springfield. It's grown into a comprehensive healthcare system. We care for 8 counties around Polk County. We serve a population of about 120,000 people, many of which have insurances, Medicare, Medicaid, and because of various funding opportunities, we're able to continue to provide for them when they otherwise might not have access to health care. In order to do that, it's really important that our patients have access to not only their treatment for care, but for their medications. And the 340B program has really provided us the ability to provide that care. Also, it's given access for all of our community to the medications that they need.
At CMH, 78% of our patients are covered by Medicare, Medicaid, or they're uninsured. And we lose money treating these patients, primarily due to inadequate payment rates from the Medicare and Medicaid programs. In addition, we provided over $5 million of uncompensated care last year to uninsured patients in our service area. The 340B program has helped bridge the gap between cost and payments for the services we provide to our patients. 340B is a federal drug program that requires manufacturers to offer discounts to covered entities that meet certain eligibility criteria. For hospitals, the main criteria is that we demonstrate that a large percentage of our patient population is covered by Medicaid. 340B does not cost the government anything to operate, and the discounts we receive are a tiny share of the huge profit margins that manufacturers earn each year. But those discounts are vital to rural hospitals like CMH. In addition to operating the program at the hospital level, we've also used 340B to develop a network of pharmacies under contract in the area to provide prescriptions to our patients. An additional part of that contract pharmacy program is that we offer discounts to the patients to help them make their prescriptions more affordable.
One of the things I enjoy about working at CMH is the patient focus on the patient as an individual, and part of this is providing substantial cost savings to them through various programs that we have through being a rural health clinic, one of those being the 340B program, but also others such as walk-in services during a certain period of time, and physical therapy and mental health care. All of those things I think are very important, and some of these things may cost a little bit more for us to do as an organization, but we feel it is our part to give back to our community to offer these services to our patients.
I, like I said, had no insurance, so Pleasant Hope clinic down here had mentioned that we could use what they call a 340B, would help pay for our medication. The Eliquis that I was on for my AFib was going to cost me $500 out of pocket. There was no way I could afford it. And without it, I would have been in a lot of serious trouble for it. But with this program, I was able to get it for $54. And that was a major, major lifesaver to me.
The 340B program is wonderful for our patients here in Pleasant Hope and in Ash Grove. It allows many of them to have access to medications that they normally wouldn't have access to. It also helps fund the clinics and the providers that are in the locations. So without that, any of these patients wouldn't even have a facility to go to or a doctor to see, let alone afford their medications or drive to Springfield or Bolivar or even further away for specialty doctors. So I mean, it's a fantastic program. It allows us to have more expensive drugs on the shelf that we normally wouldn't have. Normally we'd wait until we knew the patient's insurance would cover it, then we'd order it, and sometimes that can take 2 or 3 days, whereas this lets us have immediate access to the medications for the patient as soon as they walk in the door.
340B has a lot of moving parts and pieces and requires constant attention and system maintenance. CMH regularly hosts meetings with our pharmacy partners to discuss program logistics, new services, and population health initiatives that will benefit mutual patients in our communities. CMH is committed to being a good steward of the 340B program and continues to identify unmet needs and innovative new services to reinvest 340B savings in our community and workforce.
340B has allowed us to that cost savings. We've been able to get creative and dedicate in funding the resources that truly matter for patients, that truly improve their quality of life, their quantity of life. And I'm just really thankful for those resources, because in this position for hospital and you know, those that work in the hospital, they were called because we want to help people. We love people, we care for them. It allows us to change lives, and I know that those don't always funnel through on an accounting sheet and paint that story, but without that dedication of resources, we miss the whole point of healthcare. So I'm really appreciative of that resource in particular, because it's been a big game changer for the way we can deliver healthcare for meeting the needs of our patients in our 8-county rural service area.
The 340B program has been under attack for the past several years by manufacturers. They've been trying to restrict how many contract pharmacy programs we can operate.
The administrative burden on the 340B program has grown significantly over the last few months as manufacturers and insurance companies demand more data or require system modifiers that in many cases are just not possible at the time the medication is dispensed. Safety net hospitals in Missouri need action now. Help us put a stop to discriminatory practices before they erode a program that was put into place to keep our doors open so that we can care for residents in rural and vulnerable communities across the state.